to The Medicine Woman. I'm your host, Simi Sharma, and again, you're going to have me for the next hour. This week, we are going to be discussing a topic that many of you have rung up about. Many of you have asked us specifically to talk about this. So we took it upon our hands to dedicate this whole episode just to talking about this topic. This topic is very, very common amongst all communities. It's common in Asian communities, but it's common everywhere. And I hate to say this, but most of us at one time or another in our lives do suffer from this topic that we're going to discuss today. So the topic that we are going to discuss today is, unfortunately, depression. Depression is the one that we're going to spend the next 45 minutes to an hour talking about. And I have a very important guest speaker with me today. I have Dr. Sahota here with me.
Oh, thank you.
And he's going to be sitting with us for the next hour or so. And I've got lots of questions for him, so I'm going to be bombarding him with lots of questions. And hopefully, Dr. Sahota has got all the answers.
Well, we'll try. Thank you.
Yes, so let's start off with what depression is. But before actually I start that, let me just tell you a little bit about Dr. Sahota. Dr. Sahota is a GP. He has been a GP for the past 30 years, is that right?
That's correct.
So he's been a GP for the past 30 years and he's a lecturer at a leading university in clinical medicine.
That's right.
Do you want to tell us a bit more about yourself, Dr. Sahota?
Well, I've been
Okay. Dr. Sahota, you're very concerned with depression as an illness because you have said that depression, you have seen it in a lot of your patients. You say you see it there and sometimes they don't even realise that they have depression. But you have seen a slight change over time in their personality or in their outlook on life.
Well, like you said, depression is a serious topic and stress consequences.
Okay, so as we were discussing earlier, Dr. Sahota, depression, 1 in 5 of us suffer from depression. Quite often we don't know we're suffering from depression. It can have a very, very slow sort of creep on very slowly. And the way you know that you're suffering from depression is that you feel low all the time. You haven't got a desire to do anything. You have low feelings that just don't go away. You can't shake them off. You can't shift them. So this constant low sort of sad feeling. There's no enjoyment in wanting to do anything. There's no get up and go sort of feeling. You just feel lethargic, exhausted, and the things that would normally bring you joy, they don't bring you joy. Would you say that's someone who might be going through that, that's a slight maybe indication that they could be suffering from depression?
You are absolutely right. So there's a whole range of things which can be presented.
Right, okay. And also, as me and you were talking about this earlier, we had a slight recap. Depression is different from unhappiness because depression is deeper and it lasts longer and it's more unpleasant than just general feelings of unhappiness. So मैं आपको हिंदी में समझाती हूँ. हमने आज डिप्रेशन की बात करनी है. डिप्रेशन हम सब सफ़र करते हैं. डजंट मैटर कौन सी बैकग्राउंड आपकी है, सबको डिप्रेशन होता है. और आज हमारा जो डॉक्टर आया है उसने डिप्रेशन को एक्सप्लेन करना है. उसने एक्सप्लेन करना है डिप्रेशन क्यों होता है, इसका इलाज क्या हो सकता है. हम सबको मालूम है टैबलेट्स मेडिकेशन है, पर ये डॉक्टर ने समझाना है कि और भी स्टेप्स है जो हम ले सकते हैं मेडिसिन खाने से पहले. और डॉक्टर ने एक्सप्लेन करना, ही इज़ गोइंग टू ट्राई टू एक्सप्लेन on what you should look out for if you feel maybe you're going down that road where you are feeling a slight onset of depression. Right, so doctor, so आपने बोला है, मैं पंजाबी में और हिंदी में समझाती हूँ कि जो भी ऐसे फील करता है, if you are feeling this way, please डॉक्टर के पास जाओ, डॉक्टर के साथ अपॉइंटमेंट बनाओ और डॉक्टर को सब कुछ एक्सप्लेन करो, क्योंकि ये लोग देखते हैं every day. Probably doctor was saying a lot of their patients, if not more than half of them, come in suffering from depression. So आपको ऐसे फील होता है कि शायद आपका डिप्रेशन है और नहीं तो डिप्रेशन जैसे फील होता है आने लगा है. So please डॉक्टर के साथ अपॉइंटमेंट बनाओ. Now we are going to just characterize some of the points to look out for in depression. So you feel like maybe you might be suffering from depression if you have sadness or low mood all the time. There's no apparent need for it, but you just feel down all the time, and there's just a low mood hovering over you all the time. If you're generally losing interest in life, if you feel that you haven't got any get up and go, things that used to make you laugh, things that used to make you smile in the past, just don't have that effect, and it's just like, okay, yeah. If it's that sort of attitude all the time, then please go and make an appointment to see your doctor. If you find it hard, these are just obviously some factors. These aren't the binding factors to say you have got depression, but these are just little things to look out for. If you find it hard to make decisions and you just find that you get very anxious very quick, that's also another sign. Feeling exhausted, not having any energy whatsoever, and just feeling tired all the time, that's another sign. Restless and agitated, that's a common factor or a common symptom of depression. Loss of appetite, आपको फील होता है कि आपका जी नहीं करता खाने के लिए और आपका weight lose होता है, ये भी शायद डिप्रेशन का कुछ साइन हो सकता है. आप प्लीज़ डॉक्टर के साथ अपॉइंटमेंट बनाकर और डॉक्टर को देखो. If you have difficulty in sleeping, आपको नींद नहीं आती अच्छी तरह से and you don't know why, वो भी कभी-कभी फैक्टर होता है, so please make an appointment, डॉक्टर के पास जाओ. If you have a loss of sex drive or you have self-harm feelings or suicidal feelings, आपका जी करता है खुद को कुछ करना है, जैसे खुद को कुछ दुख मिलेगा, ऐसे आपकी फीलिंग आती है, so please डॉक्टर के पास जाना. Dr. Sahota, what are your thoughts on this? Dr. Sahota is saying here that it's very important to be open, to be able to speak. We quite often forget the importance of talking. Talking is so simple, talking is free. बात करनी चाहिए, जो भी आपके मन में प्रॉब्लम है और हेड में कुछ दिमाग में कुछ प्रेशर है, किसी के साथ बात करो. किसी के साथ बात करो, जो ये बोझ है, ये बोझ हल्का होता है. So Dr. Sahota is saying one thing that our people find, well, people in general, but generally Asians, they find it a stigma. There's a stigma attached to talking about depression. They don't want, first of all, they don't want to admit that they do have depression, and talking about it is definitely taboo, and it's almost seen like a sign of weakness. It is not a weakness, so please, if you feel that you're feeling down for no reason, talk to your doctor. If you can't talk to your doctor, talk to a friend. But डॉक्टर ने बोला है बात करनी, किसी के साथ बात करनी is very, very important, because what you find is people who do suffer from depression, they keep themselves busy, so they pile more onto themselves. Piling more onto themselves hence means more stress. More stress, they're just avoiding the issue of depression totally by not thinking about it, by taking more on, keeping themselves busy, not thinking about the main problem, and hence they end up suffering from stress and exhaustion. ठीक है ये डॉक्टर?
बिल्कुल ठीक है. देखो
डॉक्टर, आपने बोला था कि there's mainly two treatments for depression. We have talking therapy and then we have antidepressants. Now, दो treatments डॉक्टर बोलते हैं, दो main treatments है depression के लिए. एक है जो बोलते हैं उसको टॉकिंग थेरेपी है, आप डॉक्टर के पास जाओ, डॉक्टर के पास बात करो, उसको जो आपकी प्रॉब्लम है, यू टेल हिम द प्रॉब्लम. सिर्फ डॉक्टर के साथ नहीं, इफ़ यू हैव अ फ्रेंड के साथ, कुछ फैमिली रिलेटिव, उसके साथ बात करना. So that is the talking therapy, where you take the burden off yourself by talking to somebody about your illness or about the pressure that's on your head. So that's one, and the other one is antidepressants, but that is a route that you will only consider once you've considered everything else.
Well,
we'll come back to that because we're coming on to a break now.
Okay.
So as soon as we come off the break, we'll
That's
come
fine.
and discuss this again. Hello and welcome back to The Medicine Woman. As earlier, we have a guest speaker with us. We have Dr. Sahota here with us, gladly joining us, and he's talking about, well, we're talking about depression together. So before I very quickly cut Dr. Sahota off before we went on the break, Dr. Sahota, you were talking about?
Yeah, we were talking about the shame involved in disclosing sort of intimate details and personal matters. But the other big point with the Asian people is that they concentrate on physical symptoms and physical illness. And their expectation from the doctor